Parkinson's disease is a progressive neurodegenerative disorder that primarily affects the motor system. Parkinson's disease affects nerve cells within the brain called basal ganglia and the substantia nigra. The substantia nigra is responsible for producing the neurotransmitter dopamine, which plays a vital role in regulating motor control. As such, the depletion of dopamine causes an increase in the overall excitatory drive in the basal ganglia then occurs, further disrupting voluntary motor control and causing the characteristic motor symptoms of Parkinson's disease. In a healthy brain, dopamine is released from the substantia nigra, which then interacts with receptors in the striatum, a component of the basal ganglia which is critical in the performance of habitual and automatic movements. This interaction is responsible for the fine-tuning of movements. However, in Parkinson's disease, the loss of neurons in the substantia nigra leads to a decrease in dopamine levels. This decrease then prevents autoinhibition of the acetylcholine, causing it to become overreactive. As a result, the muscles become overly excitable, leading to the motor symptoms of Parkinson's disease, including bradykinesia, rigidity, tremors, and postural instability. Furthermore, Lewy bodies, an abnormal accumulation of protein that occurs in the nerve cells in the brain, can also be associated with the pathogenesis of Parkinson's disease. Lewy bodies are composed mainly of alpha-synuclein, a protein that is thought to contribute to neuronal dysfunction and cell death, although the exact mechanism or extent by which Lewy bodies cause neurodegeneration is still not fully understood. However, they are a histological hallmark of Parkinson's disease. Levodopa is the gold standard medication in the management of Parkinson's disease. It belongs in the class of medications known as dopamine agonists, which are used to stimulate parts of the brain influenced by dopamine. Unlike dopamine, levodopa can cross the blood-brain barrier, allowing levodopa to convert to dopamine in both the central nervous system and the periphery. In order to increase the bioavailability of levodopa and decrease any potential side effects, it is offered in combination with the peripheral decarboxylase inhibitors such as carbidopa. Carbidopa prevents the conversion of levodopa to dopamine in the periphery, thus allowing more levodopa to enter into the blood-brain barrier. Once converted, it activates postsynaptic dopaminergic receptors and compensates for the decrease of dopamine caused by Parkinson's disease, thus alleviating some of the motor symptoms associated with the disease. Levodopa is primarily indicated for the treatment of PD. It is used as a dopamine replacement agent to control bradykinetic symptoms. It is typically prescribed once symptoms have become more difficult to control. Furthermore, it is suggested that levodopa may slow the progression of the disease, therefore increasing quality of life. Nurses should closely monitor the patient's response to levodopa, including evaluating improvements in motor symptoms and assessing for any adverse effects. Long-term use of levodopa can lead to a reemergence of motor symptoms due to the narrowing of the therapeutic window that comes with extended use. Therefore, regular assessments and monitoring are recommended in order to prevent the reemergence of symptoms through adjusting dosage and timing of the medication. Furthermore, levodopa is a time-sensitive medication and effects begin to wear off after a few hours, which can increase motor fluctuations, leading to something known as off periods, in which symptoms return or worsen. Nurses need to provide education to patients to ensure they understand the importance of adhering to a strict dosing schedule and should be encouraged to report any changes in symptoms or new adverse effects promptly. In addition, high-protein meals can also interfere with the absorption of levodopa. Therefore, consumers should take their medication on an empty stomach or plan protein intake to ensure the medication is effective. Some consumers may need help with their meal plans, therefore nurses may involve the help of a dietitian. Given Emma's history of frequent falls risk assessments should be conducted regularly, and precautions should be taken, especially during off episodes, when symptoms return. Therefore, occupational therapists may be brought in to ensure the safety of Emma and her home environment to improve her quality of life and help her complete her activities of daily living. In addition, nurses should provide guidance on complementary therapies such as physical therapy and exercise, which can enhance the benefits of pharmacotherapy and improve overall function and quality of life.